Well, welcome to another interview in our series of family therapy practitioners who practice according to contemporary and traditional models. With me today is Cecil Walker from Atlanta, Georgia. Cecil's a graduate of Mercer University, Mercer College,
Mercer University, yes, sir.
Mercer University's Marriage and Family Therapy program. He lives in Atlanta, Georgia. He's done research in solution-focused family therapy and practices as in private practice in that area. Um, Cecil, thank you so much for being with us today. Tell me a little bit about how you got into MFT, family therapy specifically, and then how did you get attracted to solution focused?
Yeah, that's a great place to start. Well, thanks for having me, and thanks for, I think the whole idea of all of this, the premise of this is a really great one. So when I was an undergrad, I thought I would be a psychologist, an academic. I did undergrad at Emory University here in Atlanta. It's very research heavy. They kind of put you on that track to be an academic. But while I was working in a research lab, studying borderline personality disorder, we would do interviews with families. I think the thesis of the study that we were working on was that teenage dynamics between parents and their teens could make a difference for psychological outcomes in terms of personality disorders. And so while we were working on that, I just kind of realized what I cared the most was about the family dynamics. And I was lucky enough that I got to do a lot of those interviews that we were performing and keeping track of the data for the study. And so when I was kind of looking to graduate school after that, I was kind of asking myself what of my studies so far seemed to really stand out to me. And that was a really big one, is really looking at those dynamics. And so that kind of led me to start looking at MFT programs. There was conveniently one here in Georgia. And so I did that and just kind of was on a slipstream into this work from there. As far as how I got into solution focused work,
Yeah.
in my master's, I still was pretty hungry for some research work. And so I asked Dr. Madam Froer, a brilliant solution focused researcher, if I could help him with some of the studies that he was working on. And he immediately put me right to work on a microanalysis where we were studying the basically all of the words uttered in a session from all of the both past and current solution focused pioneers, whoever would be considered the experts. So obviously Steve DeShazer and Insoo Kimberg from back in the day, Yvonne Dolan, and then currently I believe we used Elliot Connie, Chris Iveson, and I don't remember who the third current one was. Maybe it was George from Brief in the UK. And so that kind of just I was thrown into the deep end of solution focused work and really analyzing that in such a minute kind of close way. Just made me really fascinated with the language and the technique and the how do you do this and what makes a difference in the questions that you're asking and seeing the outcomes and the effects of that kind of stuff. And so from there, I kind of never looked back and I just kept doing more and more work. Adam and I have published a few things together. He actually asked me to contribute to a chapter he wrote in a book that he edited on trauma and SFBT. And so I feel like I've just gotten deeper and deeper into that work. And now, years later, that's what I use for all of the clinical work that I do, as well as I participate in helping with trainings. We travel all over the country sometimes, and as well as virtual, giving trainings on helping people kind of develop solution focused skills. How do you do this work in a meaningful and effective kind of a way?
Yeah, one of the critiques of the solution focused approach is that, like, and when I present it, students will say, this seems like a Band-Aid. You
Hmm.
know, I often give an example of a woman whose challenge was, I saw this session, a solution focused session. The woman's challenge was getting to work. That's what she identified as her presenting problem. And yet it came out in the interview that she drank quite a bit, and the audience kind of turned on the solution focused therapist and said, you're being irresponsible by not going after the drinking problem, which is obviously causing her lateness for work. And that was not what the client wanted to talk about at all, the drinking and stuff. So this particular session, her focus was trying to get on work to work on time. Anyway, when I present that, oftentimes I get this kind of this kind of pushback from students, like it's not going deep enough. It's not going to the heart of the problems, and sometimes people refer to it as it's a bit of a band-aid approach. I'm sure you've heard kind of
Oh,
feedback or
absolutely.
that critique.
Yeah. I've heard those kinds of things, and that usually leads me to believe that either people haven't looked at it closely enough, or they haven't gotten to really study what the approach is about. And if they're using it, they might not be using it as effectively as they could be. I think maybe part of the way that people are misled to think it's not deep enough, to think it's more of a band-aid thing, is because there isn't this inherent kind of assumption of I've got to explore and find understanding of the problem, which a lot of other approaches, might lean on that. Steve DeShazer used to say in some of his writings that, in order to find the key to something, I don't really need to study the lock. I just got to find a key that works. And once that key works, the door is open and things are good. So there isn't this assumption of I've got to really study and figure out the problem. Uh, but there is plenty of room for meaning and really deep actual change that happens in finding what a lot of solution focused people will call like the version of themselves, the version of the client, the version of the family system even that is most capable of dealing with whatever the problem is or whatever the current situation is. And so a lot of solution focused experts, you would hear them say, I don't necessarily need to ask about that drinking problem because if we have a kind of conversation that elicits a certain version of them that causes this really meaningful change to happen, problems like drinking will start to take care of themselves. Obviously, if there's safety concerns and risk and things like that, people need to be reasonable, people need to be sensible and tend to those things. But in terms of understanding how systems work, I think all systems-based approaches are saying the way things are working when they walk into therapy clearly is problematic or less than functional. And so we need to change the system in some type of way. And when you do systemic change, all the pieces in there are moved around in some kind of way. And I think that's kind of the philosophy behind a lot of the solution-focused work too.
Yeah, I've known people. You talked about Adam Frower. Adam is somebody that was really bought into the solution focused
Hmm.
paradigm early on, and like when I see him in his like even in his personal life, he is a solution focused
Oh,
kind of
absolutely.
person, right? There's like a
Absolutely.
mentality that goes along with it, and I think that's I love that the fact that the way I practice clinically matches up with how I think about the world, right? We
Yeah.
often have our students write a theory of change paper, and I want that, and whatever theory they gravitate towards should kind of be a reflection of who they are
Yeah.
and how they navigate the world to some degree.
Yeah, yeah, I completely agree with that because I see a lot of that in myself as well. Everyone has difficulties, shortcomings, hard times in life. And whenever I see some of those things where I'm like maybe disappointed with my output, not being as productive as I'd like to be, or I'm not really accomplishing that goal that I'd like to accomplish, or maybe there's even times, where I'm feeling particularly anxious or during the pandemic and all these recent social times, I feel like, a lot of us have found ourselves in either depressed or anxious kinds of moods. Um, it's really, really helpful to be able to remind myself, well, no, there's been actually other really, really difficult times that I pulled myself through, or there's moments actually currently right now where there's kind of a bit of an exception to this lack of productivity. For some reason in this area of my life, I'm able to be really, really productive. And so if I can like embody that and call on that version of myself and bring that over here, somehow some lasting change can kind of happen. A bit of a personal example, when I graduated high school, my mother, who raised me and my siblings uh, as a single parent, she had just passed away from cancer. And so it was a really difficult time because I was transitioning into college, obviously, while also dealing with that grief at the same time. And almost any time now, years later, that I deal with something difficult, I can look at that moment of my life and kind of ask some questions around, well, how did I I graduated at 17 and had no idea how to, live independently or move through life in any kind of a responsible, independent kind of a way. How did I handle all those things at the same time? That kind of change, that kind of difficulty, that kind of grief and pain and emotional turmoil. What did I use to kind of get through that moment? What is it about me that kind of allowed me to still do well in school while also trying to process and deal with that type of, life-changing kind of circumstance? And the answers to all of those questions, I can absolutely use in anything that might come up now, especially when I kind of put into frame that most things now don't compare in size to the difficulty of that kind of a
Right.
situation.
Right.
So I think absolutely, to use it as a frame of here's just how I live and here's just how I exist. At this point, I guess it's not even really a choice.
Yeah. Yeah. The next thing that I would love for you to do is tell us a little bit about a particular or a specific intervention that is often used in according to this model. You're talking about searching for exceptions or finding exceptions. I don't know if
Mhm.
that's how you'd label it. That's probably how I'd label it. Somebody who's maybe
Yeah.
more of an outsider to this approach. But uh, is there an intervention that you could tell us that you've used with a particular family?
Yeah, I think that is a really helpful go-to kind of an intervention. I think people are very familiar with the miracle question, and I have plenty to say about that.
Yeah.
But I am pretty keen on what people would refer to as exceptions. There's been lots of other language that's been used to refer to that too. In a more updated sense, I think it was originally called in exceptions, but kind of the guys at Brief in the UK who were very close with Steve. They were kind of the torch carriers after Steve finished his work and passed away. They started calling them instances of where, the outcome that you're looking for, whatever thing you're hoping for, whatever change you want to see, instances of where that's already shown up rather than exceptions to the problem. So you can kind of see how that's
Oh,
two sides to the same coin.
yeah, yeah.
But even now, Adam and Elliot Connie, there are people referring to it as history of the outcome. So whatever end outcome that you're wanting, what's been your experience with that already so far, or current experience? And so I find myself using that a lot with families. There's one in particular that I really enjoyed working with this family. They came in, actually, it was father and son, and the mother was tangentially in the picture, but she worked quite a lot, and so wasn't always there for the sessions. But the father identified that the son was really, really depressed, and that's why they were there. But there was also kind of a communication thing, I guess, because he was depressed, he didn't speak much to the parents. They were worried about what was going on. They felt like he didn't socialize enough. He was frustrated with them quite often. Um, and so in solution focused work, part of what you have to identify way at the beginning is, like I was referring to before, what's the change that they're wanting to see? Obviously, you don't want to be depressed. Obviously, you don't want communication difficulties between your child and you, the parent. So what's the change you would rather have instead of that? And they would say things like, we want to have kind of like an open dialogue to kind of be on the same page, be able to talk more consistently. But also, the teen, he told me he would like to have more energy. He'd like to feel better. He'd like to not be in that kind of stuck, depressed kind of a place. And I asked him precisely this kind of exception seeking kind of a question. Where do you see a bit of that already showing up? Where might you see even the smallest bits of energy and the smallest bits of feeling a little bit better, talking a little bit more? And he said in band class, and it actually turned out that he's a really passionate musician.
Hmm.
He plays almost every instrument that there is, and band class is the only class throughout his whole day at school that apparently he is willing to speak. He said there are people in there that he actually likes and would consider friends, but in other classes, he's just kind of sitting there waiting to get through it. He's riddled with social anxiety or just feeling frustrated or just not feeling like he wants to engage at all. But it's different in band class. And so we were able to kind of talk through what is it about you that shows up there in band class? What's different? What are you noticing? What are you doing differently? He felt like he was freer to, make jokes and be silly and have fun, but also that he felt like there was a capability to him that came out there. He was known as being good at his instrument and known as being kind of like a section leader.
Mm.
People kind of had a more positive view of him in that space. And from there, we kind of moved to talk about, well, what if that showed up at home? What would you notice? A big problem was their morning routine. The dad would try to wake him up. He's always having trouble. He doesn't want to get out of bed. He's like fighting them all along the way. The dad would drive him to school. So what would you notice if that version of you showed up during this morning routine? You woke up as, that I have more energy. I have the passion. I have the the social kind of extension of myself. What would you notice if that showed up in your morning routine at home? And he said things like, well, then I would actually look forward to waking up. I'd actually want to get out of bed and start, moving along with things. And in fact, maybe I'd wake up a little bit earlier so that I could do all the things that I know I probably need to do, like eat breakfast and shower and kind of like grab everything that I need to get ready to go to school. And I continued that by asking, uh, that version of you, that exception, that part of you that shows up there in band, how would that version of you communicate with your dad? And he would say, well, usually on the drive to school, we sit in silence. And if it's not silence, it's actually my dad nagging me, asking me about, school, saying you should be doing this, you should have these kinds of grades. Why didn't you get this on this assignment? And he said, instead, maybe we might talk about, well, anything else. We could talk about small talk. We could talk about, anything that comes up. And he said, actually, I would really like to ask my dad about music because the dad also is a musician and he's played music his whole life. And he said, I want to ask him about, the music that he's into. I'd want to ask him about how he learned certain types of things. And of course, I would ask the dad too, what difference would that make to you if you got to have these kinds of conversations with your son? And that was all he was looking for, was to have those exact kinds of conversations, things just about trivial things or really important things they're passionate about, just to hear about how his day is going, all those kinds of things. And so it starts to open up this really fruitful and meaningful kind of conversation. And without forcing it, or without, even like we were saying earlier, digging into, well, the problem is depression, and the problem is, whatever current communication style that you have between, your parenting style, or between you and your son. Instead of that, it's kind of like we just found a seed of that thing that they're saying that they want already being present somewhere in their life, and then letting that seed flourish in whatever way that it needs to. And then the next several times that I talked to them, they would say, actually, on the way here, we had exactly those kinds of conversations. On the drive over to your office, we something came on the radio and we talked a bit about it, and that kind of spread to a whole conversation about music and songs and all these kinds of things. Um,
Yeah, you open up possibilities, right? You're,
exactly,
you're
exactly.
doing it like an entire session of what if, right? What if
Yeah,
that person
yeah.
showed up, and what if that person and is the dad there while you're having this conversation with the son?
Not always, but a few of those times, yes. In that first session, he was there.
Yeah.
So
So the
it
dad
was
hears
back and
so,
forth.
so, so the
Oh
dad
yeah,
hears him saying
yeah,
there's instances, right? I'm going to use your language. There's
yeah,
instances where I show up differently. And
yeah,
so it gets the dad to be curious. Yeah, wonderful, wonderful description of an intervention. And you paint a really good picture of this family. Like what was a kind of a narrow and confined conversation becomes more open,
yeah.
open to possibilities, right?
Absolutely. And
Yeah.
I think if you wanted to, you could translate all of that into some of these other approaches that people are willing to say, oh, of course, that's a meaningful, deep kind of approach, like a
Uh-huh.
narrative therapy, or even CBT. You could translate that over into, we broke through some black and white thinking or something, or you could translate it into we externalize the problem and reorganize the narrative there to be, something differently. If you really wanted to, you could use that language, but I think that same kind of change is happening in that conversation.
I love it. Cecil, thank you so much. Hey,
Yeah.
do you have any advice you'd give to people who are maybe toying with the idea of solution focused,
Um,
adopting it or being attracted to it?
Yeah, I would say, I think people get scared away from it because it feels like there isn't enough depth to it, or that they aren't allowed to talk about problematic things, or that, it's this toxically positive kind of approach or something like that. And none of those things are true at all. And so I would say if you're the kind of person who, you're studying, you're learning MFT, and you're trying to find what are the approaches that really speak to me. If you're the kind of person who likes to see like the beautiful things in people, who like to experience people as brilliant, who likes to just kind of look at things in a way that says like what's possible here, or what even really speaks really really strongly and passionately to me in this situation, or into this person, or in this relationship, which I think is quite a lot of people, then this is definitely an approach that you could use well, because that I think is the foundation of it. Is if you're a people kind of a person who looks at another person and says, regardless of what's happening or the context that you're in, I know that there are these brilliant things in there somewhere, or these possibilities in there somewhere. And so I would say that should lead someone to kind of pick this approach up and use it really well. And it might take some practice or some kind of studying up on things, but I think that's what this approach is all about.
Yeah, Cecil, thank you so much for being with us today. You did
Yeah,
exactly what I was hoping. The example was great. It shows how expansive this can the expansive impact of this
yeah,
intervention. Looking for instances, special exceptions to the norm, and things like that. Thanks for being with us
absolutely.
today.
You're very welcome. Thank you for having me.
All right.